What's up, you guys? My name is Miguel, fellow Xray Tech here, giving you your daily dose of radiation. In today's video, we are covering the importance of the workflow as an Xray Tech and how majority of the times each floor, or maybe certain doctors or the physicians, or don't understand how we prioritize stuff. And at the beginning of my career, you always been told there's that the stats, X-ray comes first, and that certain floors, maybe at your hospital, that's where I work at, have priority, right? So let me give you an example, because over the time and even just talking to people, and majority of the times it's not really, some floors it is the nurses, some floors it's the doctors that push the nurses, and at the end of the day, it always, when they call you, they always want you to drop whatever you're doing and go right to them. And depending on where you work at, depending on the amount of people you have, maybe you can. Where I work at, I work the night shift, trauma 3 ER. There's only 2 of us, right, for the whole hospital. Most nurses that are new to our establishment do not know that there's only 2 X-ray techs, because they see that there's like about 150 nurses at the establishment. So when they call our department, they're like, oh, okay, well, they'll send someone, right? And there's been times where they're like, we called you, and I'm like, yeah, we told you we'd be there. So why you call us? Like, keep on calling us over and over and over. Like, we didn't tell you. Like, we're not grown. Like, it amazes me. And for certain stuff, yeah, like, you'll call, we'll go straight, like, right away. If it's like rapid response or it's like a true trauma, yeah, fine. Like, we will maybe leave what we're doing and we'll just make our way up there right away within, I mean, for any wing of the hospital, probably 2 to 3 minutes is probably the fastest we can make it, between the elevators, getting there, anything in the way, portable issues and stuff like that. Probably that's the fastest we can. In the daytime, it's even worse, because you have more traffic, you have more people, you have the elevator situation, you have so many things, and then they will start to page overhead. And I understand when they do that, if they never reached anyone in our department, and they'll do that over and over and over, and then it makes us look bad. And there's been a few times where I've worked daytime, and it made it seem like no one picked up the phone, no one understand. Like, we've had our manager call us, we have everyone like, yeah, we know, we're making our way there, like, so-and-so's in the trauma, so-and-so's this. Like, sometimes the doctors are impatient, or the residents are impatient or don't know. They'll just, like, even the nurses sometimes will come up there and we're like yeah, we know you called. Like we're not kids. Like, we know you talked to one of us. We told you we would be there. And it just happens over and over. Same thing. They want everything down. For like certain stuff, like, yeah, it's understandable. Like, the patient, like, we'll go up there, patient's dying, like get rapid response. Like, I'll be like, yeah, okay, this is acceptable. Like, other times we'll get there, patient will be asleep, and then we'll be there like, this is your stat, this is who's dying, this is who you, like, calling us, blowing us up, going above and beyond, just cause what would, like, even sometimes I like it when it happens and our manager's there, or like, there's been a few times where our manager had to work overnight and then gets to see it, and then he understands, because every once in a while something will happen and the little situation will go up to the level of where the meetings of all the managers, and they'll talk, and occasionally it'll be complaints of Xray not being on time, or Xray having, like, there'll be something, right? few of those times my manager gets involved, and he'll be present because of what happens. And every time he's like, well, majority of the times we're limited, or we'll be in the trauma room, we'll be this, we'll that. Like, we try to explain to them what's going on, and they're like, oh, well, we didn't know, or oh, and like, or sometimes like they'll be very pushy for certain stuff because they want everything now. And it amazes me that everyone wants our department now, and half the time we never bother no one. That's the sad part. We never ask for no one, for nothing. We don't call anyone. I think our department is very notorious. I mean, like, sometimes certain floors, we know that if they call over and over and over, like certain floors, regardless of how many times they call us, like, we know it's not staffed. And sometimes they know this and they'll call multiple times, and we're like, yeah, we know. So it sounds like a rant, but I'm sorry. You, as a tech, especially if you're new to our field, I'm just trying to sometimes get you to understand before you start running yourself. At the beginning of my career, I didn't understand it. And I was just like, oh, well, they called. And then you just be kind of like, your work efficiency and the way you kind of like make runs around the hospital was different. As soon as I slowly understood what was going on, and you can kind of prioritize certain stuff, it makes your efficiency way better. So be prepared for that. I know certain like hospitals, you have enough staff, so you like it'll be easier. And just be prepared. I mean, I know there's certain like floors, like let's say ICU, NICU, or surgical ICU. There's certain floors that have higher priority. Always, even if it's like some more regular, not stat, but kind of stat, not rapid response type of, like certain ones have a little bit more priority compared to other floors where the patients are just like, maybe they're going to pre-op, like, okay, they need this exam for pre-op. Okay, pre-op's usually like between 5 to 4 in the morning before they go to surgery. Like, okay, if it's 12 o'clock, like, I have time, like, we'll get it during our morning portables, which certain nurses who work different shifts don't understand, because like stuff done at night is done a little bit different than stuff's done in the daytime. Majority of the times at night, we stay in the ER because that's the highest priority. Anything else, unless they call us, kind of wait. Just do it during the morning port run, because if, for those who aren't familiar, overnight you get a list about 12:30 at night of all the chest x-rays, KUBs usually you have to do around the floor, and the doctors usually come in between 6 to 7. That's kind of when they start looking at all the images, and they kind of want them done before that. And you have all the add-ons. Wish y'all the best of luck in this field, but just know that there's been times where they just start calling and calling, and if it's like one floor calling, it's not even that bad. You're like, okay, we'll be there in a minute. It's when multiple floors start calling and start prioritizing, like, hey, this is so and so, I need you to come, and we're like, okay. Then someone else calls, and then someone else calls, and there's been times where we've had like 5 different people call us, different sides of the hospital, like different things, and then you have like a little list, and then you as a tech and you and your other partner can be like, okay, you're stuck in the trauma doing this. You're like, okay, which one of these should I prioritize first? Because like it can sometimes get kind of chaotic. And I don't know. Sometimes it gets kind of irritating. But anyways, I hope you enjoy this field. I do love it. Sometimes it gets annoying because people don't understand how stuff works in our field. But yeah, it's been your boom gal. We'll see you on the next one.